I had COVID symptoms about 3 weeks ago. Started with fever and a bit of cough. And then at that time, the COVID testing for NHS staff was readily available. So I suffered for about 2 or 3 days with the symptoms, and then I got tested. I should say our occupational health and everyone were just fantastic. I had to drive through and got that tested. It was a scary time. Like anything, I was quite anxious and scared about outcome, especially when you hear about all the stories and things that you hear and things that you've seen as well. Unfortunately, my wife subsequently also had COVID a couple of days later, and my 7-year-old daughter also got COVID. So it always sometimes made me feel guilty as I've given it to them. But luckily, my 7-year-old daughter, being a young girl, it was just for a day, and she completely, fully recovered without a complete issue. My wife, it took a little bit longer, but she also recovered within about a week. For me, it was a much more difficult experience. There were times in which I was extremely scared because of the symptoms I was getting, and very, very worrying because it was quite a very difficult time. But was managed to pull through. A lot of my friends and people gave us tremendous amount of support. Across the NHS, it was almost like a family. Colleagues that we were working through were always willing and ready to help in different shapes and forms. It really brought a good spirit within, that there was somebody else also willing to fight along with you. So that was really helpful to have that amount of good colleagues and good people who were always inquiring. It was not only from colleagues, it were people who were much higher on the NHS chain, people who are much lower on the NHS chain, always wanting to help and always inquiring. So that made me feel good. It stayed for about 2 weeks, but however, the post-viral fatigue was extremely difficult. And it really did hit me for a 6. I don't think I've experienced any illness as bad as this. I'm so grateful that I've come out of it. Now I've come back to work for the last couple of days, and I've been taking it easy. I have to say that, again, there's been no pressure on me to come back fully, and I've been given enough time time to recover back and slowly ease myself back into work. So that's what I'm doing now. So I was getting, initially it started, as I said, with cough and fever, and subsequently I developed shortness of breath, and my saturations went quite low, along with what we call as a pleurisy, which is a pain that you get. I got some minimal lung issues, so it was quite scary whether that's going to get worse. At the same time, I didn't feel, because it warranted me coming in to get admitted, but it was quite close. And I was one of the lucky ones who recovered through the period without having to either come into the hospital or get admitted. I come from, so the impact was, for my family, was quite difficult, especially watching me when it were quite tough. When there was a 24-hour period where it was quite tough for them to watch it. I also come from, I'm come from India, so all my family are back home. And for them to hear issues, but at the same time not able to see me, was another traumatic experience for them. That was quite difficult, more so when my family who were able to see me or do something for them. For people who can't see you and just hear news about you, it's more difficult about how things are going to evolve into. But certainly with our current social media and everything, it certainly helped the process. But that is something that it was quite difficult. But at the moment, we're all glad that it is over now. It is an anxious time. There's no doubt about it, and we're all working this through. For everyone, it is a new thing, and we all go through in our own minds in different shapes and forms. And we need to allow people to have those anxieties. And the biggest thing that we have is the ability to talk to another person. Anxieties, if you keep them within yourself, it's not going to be quite good. So whatever anxiety that you have, speak to another colleague, speak to somebody that you can need to. And if in case you've been unlucky to get symptoms, most of these symptoms you recover from. And even if you need to get admitted, most people get discharged and do get to go home. However, we have, as healthcare professionals, seen a lot of healthcare workers who, many, I wouldn't say a lot, but many healthcare workers who have not made it through. And certainly that is quite difficult to take. And they certainly are our heroes for what they've gone through. But we also should make sure that our well-being is good. So speak with members of your team, speak with members of your staff. If you develop symptoms, certainly speak with your line managers, speak with occupational health, and make sure that you get tested. With the current capacity, we should be able to test everyone, and certainly follow what the national guideline says. But at the same time, our colleagues and friends and teams are the people, and it does appear to be one NHS family that we can take this through.